Script for Rebecca.
Yeah.
Hi there. I'm Lexington Pharmacist today. Just got a script here for you. Now it's for the nitrolingual pump spray. Now, do you know what you're using this one for?
For my angina.
Yeah, that's right. So that crushing pain in your chest. And you haven't had it before, have you?
No.
No? Are you on any other medications?
I take Lipitor, Ramipril and Cardia.
Okay. You've had a myocardial infarction in the past, is that right?
Yeah, I had a heart attack.
Yep. Cool. You don't have any allergies? No. And no other medical conditions apart from that?
No.
No? Okay. So yeah, with this one, it's a spray. So where it goes, just under the tongue, okay? You don't want to inhale this one or spray it to the back of the throat and swallow it. It goes just under the tongue, and that's where it's best absorbed. Okay. Now, the instructions for use is one spray as necessary. So you're only using this one when you get an angina attack.
Okay.
Okay. So there's the spray for you. Before you use it for the first time though, you've got to give it 5 sprays just to prime it. Okay. Make sure we're getting the medicament out of there. Okay. So it'll be 1, 2, 3, 4, 5, and the 6th spray will go under the tongue. Now, if you haven't used it for say a week, you only need to give it 1 spray to prime it. Okay. And then you can administer it. Okay. But if you haven't used it for say 4 months, it's just been sitting there, got to prime it 5 times.
Okay.
Just remember that. Okay. Also, do you find that certain activities exacerbate your angina?
Yeah, sport, going
Exercising, that kind of thing, yeah. So it's quite reasonable to take a dose of this one, 5 minutes or 5-10 minutes before you go and do that activity.
That's just 1 spray as well?
Yep, 1 spray. And yeah, if your angina is still exacerbated, obviously stop the exercise and take another dose. Okay. Now, after your 2nd dose, you can wait 5 minutes, and if the pain hasn't subsided, you're going to have to call an ambulance, which is the procedure when you're having any angina attack. You can take up to 2 doses at a time, okay, spaced 5 minutes apart. But if you're still suffering angina symptoms after those, you need to call the ambulance because it is an emergency. Okay, and just a few side effects for you. Okay, can get headaches. Most importantly though is dizziness and lightheadedness, those kinds of sensations. So what we encourage you to do is when you first start this medication is to be sitting down when you administer it. Okay, just in case you get a bit lightheaded and fall over, it'd be better if you were sitting down. Okay. Also try and avoid operating heavy machinery or doing anything too physically demanding when you administer this, because it does have the potential to make you faint.
Okay.
Okay. Also, another important piece of information about this one is you need to make sure you keep it in a dry, cool place. Okay. Try not to keep it in your car, glove box, or in the bathroom, in your vanity. It gets really hot in the car, or it gets really moist in the bathroom. It can compromise it a little bit. Okay. So yeah, just remember, dry, cool place.
Handbag, is that fine?
Handbag's fine.
Okay.
I mean, you're going to have to keep it on you because it's unpredictable when you're going to get angina attacks, and you're going to have it. Okay. Also, protect from light. Don't leave it out in the sun.
Sure.
Okay. Were there any questions about that one?
No, I think that's everything.
Yeah. Oh, one more thing. If you find that you're using this too frequently, okay, say every day, okay, it's going to be best to go back to your doctor and review your therapy, and he might put you on a long-acting nitrate. So you don't have to administer it as necessary. You take it every day. Okay. It represents increasing severity in your angina, but it's important to note that.
Great.
Okay, and that's all. I've got a little CMI here for you. It's just a bit of information on the medication. Did you want to take that?
Yeah,
with you?
sure.
Excellent. There we are.
Thank you.
No worries.